Imagine walking into a school district central office, taking $25,000 in crisp bills, and just feeding it straight into a paper shredder.
Right, just instantly gone.
Exactly. Now imagine doing that every single time a teacher packs up their desk and leaves the profession
Yeah.
in a district where, funding has already been slashed to the bone.
It's yes, the massive financial sinkhole. And today we're looking at how this sinkhole is currently masquerading as a wellness problem.
Welcome to today's deep dive. If you're joining us, you are likely someone who wants to understand not just that a system is broken, but the hidden mechanics of why it's breaking.
Yeah, and we have a really fascinating stack of research in front of us today. We're focusing on K-12 mental health support, specifically looking at data out of Georgia schools provided by an organization called MentalSpace School.
And our mission here, just to be clear, is not to just throw around the word burnout. Like, we know teachers are stressed. We all know that.
No. Oh, absolutely. The goal of this deep dive is to deconstruct how standard, corporate-style wellness programs are actively failing our educators,
Right.
and why treating mental health as this isolated personal failing is actually costing taxpayers millions. Plus, what an actual structural intervention looks like.
Okay, let's unpack this, because as we look through this data, there is a central theme that just keeps popping up.
Hmm.
And it's the question we want you, the listener, to keep in the back of your mind as we go through this today. Are we currently using the word resilience as a weapon to avoid fixing broken systems?
Ooh, that's the big question. And to answer that, we really have to look at the daily reality on the ground. The data provided in our sources paints a pretty stark picture of the baseline operating condition in these schools.
Yeah, tell them the stat, because it's wild.
Right, so 44% of educators report high daily burnout.
Almost half. I mean, think about the sheer scale of that.
It's huge.
If you are walking down the hallway of middle school, nearly every other teacher you pass is not just, having a bad day. They are operating in a state of chronic, high-level daily burnout.
Which brings up a concept the research identifies as the resilience trap.
The resilience trap. I love that phrasing.
Yeah, it's fascinating because the definition of resilience has been entirely co-opted by institutions. Psychologically speaking, resilience is just the ability to bounce back from an acute stressor.
Like a one-off bad event.
Exactly.
Oh.
But in the context of our modern education system, resilience has become this very convenient buzzword. It functions as a mechanism for a massive system to take the structural cost of stress and just push it entirely onto the individual employee.
I want to challenge this a bit, though, because, we talk about resilience as a positive trait all the time, right?
Sure, we do.
We actively try to teach kids to be resilient. So why is it a trap when we apply it to the adults teaching them?
Because of the environment it's being applied to. When a teacher's managing a classroom of 30 kids, dealing with complex behavioral issues, navigating endless administrative paperwork.
And buying their own school supplies.
Yes, buying their own supplies. And the administrative response to their sheer exhaustion is to, host a seminar on building resilience.
Wow, yeah.
What the system is functionally communicating is, the problem is you.
Right.
It's saying the issue isn't the crushing workload or the lack of resources. The issue is your personal inability to handle a completely dysfunctional environment.
It's essentially a shifting of blame. It's like looking at a car engine that has been running without oil for 10,000 miles.
That's a great analogy, yeah.
And when the engine finally seizes up and starts smoking, the mechanic blames the engine for not being mentally tough enough.
Right, you just need to be a more resilient engine.
Exactly. It completely ignores the environment the engine was forced to operate in.
That's the exact dynamic. The system demands infinite output with finite resources, and then pathologizes the natural human reaction to that stress.
Which is so damaging.
And the consequence of this resilience trap is that educators are left feeling incredibly isolated. But, more importantly for the districts themselves, misdiagnosing a structural failure as a personal weakness means they are bleeding money.
Just an astonishing rate. Let's get into the actual math on that, because the direct costs alone are staggering.
They really are.
When a teacher finally hits the wall and resigns, replacing them costs an average of $20,000 or more.
And that number actually scales depending on the geography, too.
Oh, really?
Yeah, in a rural district, you might be looking at around $9,000 to replace an educator. But in a large urban district, that replacement cost easily exceeds $25,000 per teacher.
Just to put a body back in the room.
Exactly.
We are talking about the hard costs of recruiting, interviewing, background checks, onboarding, and the inevitable loss of productivity as a new hire gets up to speed.
And those are just the numbers that show up neatly on a spreadsheet.
Right. The data highlights that this $20,000 is merely the tip of the iceberg. The indirect costs create this massive domino effect.
If we connect this to the bigger picture, the indirect costs are where the foundation of the school really starts to degrade.
What's the first thing to go?
The first thing you lose is institutional knowledge. When a veteran teacher walks out the door, they aren't just taking their lesson plans, they're taking like a decade of community relationships.
Oh, man. Yeah, they know the families.
Exactly. They know which families need extra grace, they know the specific quirks of the building, and they serve as informal mentors to the new staff.
So when they leave, that mentorship just vanishes.
Right, which means the new, younger teachers coming in have less support, making them way more likely to quit.
It becomes a completely vicious cycle. And then there are the daily operational stopgaps. Like, think about the substitute teacher budget.
Oh yeah, that's a huge drain.
You have a staff that is deeply burnt out, so they are utilizing every single sick day they have just to cope with the exhaustion.
Mental health days, basically.
Yeah, and the district is then forced to pay daily premium rates for substitute teachers just to keep the building legally supervised.
There are also massive macro-level financial impacts to consider here. The sources point out the loss of grant funding.
Wait, how does that connect?
Well, many state and federal school grants, and even private funding, are directly tied to student outcomes and standardized test scores.
Okay.
If your teacher turnover is high, the school culture is unstable. When the culture is unstable, student outcomes predictably drop. And when those scores drop, the grant money disappears entirely.
Wow. But here's where it gets really interesting, though. Out of all these hidden financial drains, there was one specific correlation in the data that I found just fascinating.
Which one?
It's the cost of the timeline before the resignation. We tend to hyper-focus on the empty desk, right? And the cost of replacing the person who left.
Need the aftermath.
But there is a massive hidden cost to the teacher who is still sitting at the desk but is completely drained.
Oh, absolutely. This raises an important question about the ecosystem of a classroom, because the data shows a direct, measurable correlation between a teacher's emotional dysregulation and a sharp increase in student disciplinary incidents.
Let's break that down for a second, because a burned out teacher's nervous system is basically like a house running on a faulty electrical panel.
That's a good way to picture it.
Right. When a teacher is regulated and supported, a student acting out or getting loud is just like plugging in a toaster.
The system can handle the draw.
Exactly. The teacher de-escalates it, redirects the student, and the lesson continues. But when that teacher is experiencing chronic burnout, their nervous system is fried.
They have nothing left in the tank.
Zero. So that same student behavior, that same toaster, trips the main breaker, and the whole house goes dark. A minor issue escalates into a major conflict.
And let's follow the administrative trail of that trip breaker, right? Because that escalated conflict in the classroom results in the student being sent out of the room.
Which generates a formal disciplinary referral.
Exactly. The referral goes to the principal or vice principal, who now has to spend 30 minutes dealing with the student.
And then the inevitable parent complaint comes in.
Oh, always. So now you have administration, counselors, and the teacher all pulled into a 45-minute parent-teacher conference.
You are burning hours of expensive administrative time dealing with a conflict that stemmed fundamentally from an adult in the room who did not have the psychological support they needed to stay regulated.
It's a massive drain on the entire building's resources. So school districts obviously see this happening.
Right. They see the turnover numbers, they see the disciplinary spikes, they hear the parent complaints.
And they want to stop the bleeding. But according to the research, the tools they're using are completely inadequate.
Because the standard administrative response relies on what we call signaling rather than actual intervention.
Yes.
Signaling.
We see the list of standard remedies in the sources, and it is universally frustrating for educators.
It's almost insulting sometimes.
Yeah. The district will declare a casual Friday where teachers can wear jeans, or they might put an espresso machine in the break room, or buy the staff a bulk subscription to a meditation and yoga app.
Those are classic examples of signaling. They are highly visible, relatively cheap ways for a school board or a district office to signal, hey, we care about your wellness.
Look at us helping.
Right. But an app does not address the physiological reality of structural burnout.
It's like throwing a pizza party for a crew of firefighters who are currently trapped inside a burning building.
That is exactly what it's like.
The gesture is nice, but it does absolutely nothing to extinguish the flames around them. And yet, if you ask a district about their mental health support, they will inevitably point to their Employee Assistance Program, their EAP, as their primary clinical intervention.
But the reality of standard EAPs in the education sector is a glaring failure.
Really? How bad is it? The national utilization rate for standard EAPs sits at an abysmal 4 to 7%.
4 to 7%.
Yeah.
If you buy a software program for your company and only 4% of your employees use it, you fire the software company. Why is the utilization rate so incredibly low?
Because standard EAPs are built on a foundation of friction. And friction is the enemy of someone in a mental health crisis.
Okay, walk me through that. Think about the actual user experience.
Right, so a teacher is in crisis. They finally decide to get help. They have to track down an 800 number, they call it, and get put on hold.
Of course.
And when they finally get through, they aren't speaking to a therapist. They are speaking to a triage operator.
Oh, wow.
So they have to bare their soul and explain their crisis to a total stranger who is just checking boxes on an intake form.
And what happens after the intake? Like, do they get help then?
They get put on a wait list, often for 3 or 4 weeks.
You've got to be kidding me.
No, and when they finally do get an appointment, it's often in the middle of the workday, or it's with a general practitioner who have absolutely no understanding of the specific, unique pressures of running a modern classroom.
Because a teacher might only have a 20-minute planning period all day?
Exactly. They do not have the time or the emotional bandwidth to navigate a bureaucratic maze. So they hang up the phone, and the resource sits entirely unused.
So if you are listening to this right now, and particularly if you are a superintendent, a district administrator, or sitting on a school board here, is a strategic question you have to ask yourself. What does our current staff wellness program actually cost? And what is it actually delivering? If you are paying for an EAP that only 5% of your staff touches, you do not have a wellness strategy. You have a checking the box strategy.
And the data makes it incredibly clear that checking the box is no longer financially or operationally viable.
No, it's not.
Real intervention requires providing clinical-grade mental health support delivered with the exact same accessibility, dignity, and confidentiality that teachers would expect from their dental or physical health benefits.
So if standard EAPs are a logistical nightmare for an educator who barely has time to eat lunch, any real solution has to fundamentally eliminate the waiting room.
Yes.
How do we actually do that? The sources provide a case study of a model operating right now in Georgia called MentalSpace School. And their approach to structural intervention flips the entire EAP model on its head.
What's fascinating here is how MentalSpace systematically removes every single point of friction we just discussed.
How so?
Well, they provide K-12 mental health support exclusively tailored for Georgia schools. And the absolute cornerstone of their model is same-day teletherapy.
Wait, same day. Not a 3-week wait list. Not an intake operation.
Exactly, same day. And because the support is accessible almost immediately, the utilization rates completely invert. We talked about that 4 to 7% EAP rate.
Yeah.
MentalSpace's same-day teletherapy utilization rates sit at a massive 35 to 45%.
That is a staggering jump in engagement. And the scope of what they offer is really comprehensive too, right?
Oh, yeah. They provide dedicated therapist teams assigned specifically to individual schools.
Wow.
They handle crisis intervention, suicide and violence prevention, structured staff wellness programs, and they even extend support out to family counseling.
The composition of those therapist teams seems like a critical differentiator, too. The data highlights that these are fully licensed, diverse therapists who are culturally competent.
Right.
But perhaps most importantly, these are clinicians who deeply understand education environments.
Yes, that's huge.
Let's clarify why that matters. Like, why is it so important that the therapist understands the school system?
Because the vocabulary of a teacher's stress is highly specialized. These therapists understand what it means to manage an IEP, an individualized education program.
Which involves incredibly complex legal and educational requirements for special needs students.
Exactly. They understand the crushing weight of state standardized testing pressure. They understand how to navigate adversarial parent dynamics without losing your career.
So a teacher doesn't have to spend the first 4 therapy sessions just explaining how a school works.
Precisely. The therapist already knows.
That shared context must be incredibly validating. But let's talk about the logistics, because anytime you try to bring clinical healthcare into a public school system, the administrative red tape usually kills the project.
Oh, absolutely. There are massive compliance and privacy hurdles.
And rightfully so. Privacy is paramount.
Right. But MentalSpace handles the compliance backend by being fully HIPAA and FERPA compliant, ensuring that a teacher's or student's therapy records are completely confidential.
Meaning they're never mixed with their academic or employment files.
Exactly. Furthermore, they are structured to provide crucial support for the upcoming HB 268 deadline in July 2026.
Just to give some context for those outside of Georgia, HB 268 is a state House bill that is about to significantly tighten the mandates around school safety, mental health protocols, and reporting requirements.
Right. So for a Georgia school district, having a mental health partner whose system already aligns with those upcoming legislative mandates is a massive relief for the administration.
I bet.
And for the teacher's perspective, MentalSpace makes the therapists available outside of traditional school hours.
Which is vital. A teacher can't exactly step into the hallway in the middle of teaching third-grade fractions to have a heavy emotional therapy session.
No, of course not.
Yeah.
It has to fit into their actual life.
Yeah.
Accessibility is everything. But the final piece of the puzzle, and arguably the most important one, is financial accessibility.
Yes, okay. This is where I have to admit I was genuinely confused when I read the source material.
How so?
The data outlines their insurance integration. They are universally covered in Georgia, in network with all major carriers: Blue Cross, Blue Shield, Cigna, Aetna, United Healthcare, Humana, Peach State, CareSource, Amerigroup.
Basically everyone.
Right. But then it notes that for Medicaid, the cost is $0. Wait, let me stop you there. $0.
$0.
How is that financially sustainable for the provider? Like, if it's completely free for the end user on Medicaid, what's the catch?
There really isn't a catch for the user. It's simply that MentalSpace has done the exhaustive administrative work of fully integrating into the state's existing healthcare apparatus.
Okay, so how does the billing work?
By being in network with the managed care organizations that handle Georgia Medicaid, the services are fully billed to and reimbursed by the state's healthcare system.
Not out of pocket from the family or the teacher.
Exactly. It removes the final, most debilitating barrier to entry: financial anxiety.
Wow.
When a family or a staff member is in crisis, they don't have to choose between getting clinical help and paying their electric bill.
That's incredible. When you put all of that together, same-day access, after-hours availability, therapists who actually speak the language of the classroom, and zero financial friction, you finally have a system that works.
A system that actually intervenes.
So what does this actually mean for the school? What is the return on investment when a district stops buying yoga apps and starts implementing clinical-grade intervention?
The outcomes are undeniable. Schools that partnered with this clinical-grade model saw a 23% lower teacher turnover rate.
23%.
Yeah.
If we go back to our math from earlier, think about how many $25,000 replacement costs that saves a district in a single year. That alone pays for the entire initiative.
Easily. And it specifically improved retention during the first 3 years of a teacher's career, which is the exact window when the highest rate of professional attrition occurs.
That makes sense.
Additionally, schools saw an 18% reduction in sick day usage.
Which instantly slashes the budget for daily substitute teachers. We are seeing the domino effect work in reverse now.
Exactly. But the most profound data points aren't just about the adults. Because the teachers are emotionally regulated and clinically supported, schools reported a 15% improvement in classroom climate ratings.
That's huge.
And that trickles directly down to the students and their families. The MentalSpace outcomes show an 89% improved student attendance rate, a 92% reduction in anxiety, and an 85% family satisfaction rate.
Okay, wait. I understand how providing teletherapy keeps a stressed teacher from quitting. But how exactly does giving a teacher therapy result in an 89% improvement in student attendance?
It's a great question.
Like, what is the actual mechanism linking those two things?
It comes back to psychological safety and nervous system co-regulation. Children are incredibly perceptive to the emotional state of the adults in authority over them.
Oh, for sure. They pick up on everything.
They do. If a teacher is dysregulated, impatient, and operating in survival mode, the classroom feels tense. It feels unpredictable and ultimately unsafe.
Yeah.
Students naturally want to avoid environments where they feel anxious or where conflict is constantly escalating.
So they fake sick or they just skip school?
Exactly.
Hmm.
But when a teacher is supported, they have the bandwidth to be patient. They de-escalate conflicts gently. They create a classroom environment that feels stable and welcoming.
And when the classroom feels safe, student anxiety drops.
Right. And when student anxiety drops, school becomes a place they actually want to be, rather than a place they are trying to escape. The teacher's mental health is the direct mechanism that creates the student's attendance.
That is profound. So, what does this all mean? To summarize our deep dive today, we have to stop using resilience as an excuse to normalize under-resourcing our schools.
Yes.
Real effective intervention is not a pizza party, and it's not an 800 number that nobody calls. Real intervention means providing clinical-grade mental health support with the exact same frictionless accessibility as any other essential healthcare benefit.
Absolutely.
If you want to dive into the source data yourself, or if you want to see how this specific model works, you can find the contact details provided in our research at mentalspaceschool.com, or reach out to them directly at mentalspaceschool@hrstherapy.com.
As we wrap up today, I want to leave you with one final thought to mull over. We've just traced the undeniable line between a burned-out teacher and higher student behavioral incidents, lower attendance, and increased conflict. So as you think about the schools in your own community, consider this. What if we completely stopped viewing student behavioral issues solely as a student problem?
Right.
What if we started viewing those issues as the most visible symptom of a highly stressed adult ecosystem? If a teacher's mental health dictates the safety and the climate of the entire room, is the mental wellness of our educators actually the most foundational curriculum being taught to our kids every single day?
Wow. That completely changes how you look at the entire concept of education. You can't expect the students to thrive if the adults holding the roof up are collapsing. Treat the foundation right and everything else rises with it. Thanks for joining us on this deep dive. We'll catch you on the next one.